when you think about blood drawing, what comes to mind?
Pain.
Taking a needle, going in, preparing a full area for your needle draw.
Sticking my patients with needles. You know, a needle stick, you know, puncturing somebody.
I hope it's not going to be a difficult stick. I hope, you know, they'll have something left. I hope that there's somewhere for me to draw from.
It's interesting because you say blood draw, even to me as a person, not even as the chief medical officer, and all I can think of is someone coming at me with a needle.
Everybody knows it's a huge patient dissatisfier. It's a huge anxiety provoker, but we've all accepted it. It's just the way it's always been, and it has to be.
There's such emotion around something as seemingly small as a blood draw, and yet it's a huge deal to patients.
In one stay, they can have close to 100 draws easily. And that is something that will stick with them the whole time. Hey, look at all these bruises I went home with because they were drawing me constantly.
And so when I think about the delivery of care and getting a line in patients, I've talked to many nurses, both pediatric and in adult floors, who really fear trying to get a stick in somebody, especially when they have hard sticks, as they call them.
I know for me, it will sometimes take an hour to actually complete a full blood draw on a patient. Because sometimes you might get one tube from one spot and then the vein blows, and now you have to draw from another spot.
I'm ready. A little pinch. That's what they say. 1, 2, 3, ouch.
Yeah, I know, little pinch, right? She says, yeah, little pinch. I said, I know it's not a little pinch, it hurts, but what do you do? Okay, my name is Joan Radin. I'm a licensed registered pharmacist in Brett Lear Pharmacy, which is my business, which I've owned for 41 years, and it's been here 100 years this year. On February 25th, I was having an attack, and my daughter called the ambulance, and they took me to the hospital, and they put me in ICU. First day I was there on Friday, a young man came in, and he did a line for me. There was a girl come in, she was going to take blood, and she was standing there, we were talking. He said, okay, I have the line and I'm all set. So I said, okay, you can come over on the other side and take the blood. She said, all right, I already have it.
Okay, drawing your blood right now. Let's check your blood counts out again.
I think it's a good thing if you can draw it from one area. Sometimes they have a hard time finding your vein, so if this is going to eliminate a lot of the process of doing that and being jabbed all the time, so I think it's a good thing if it's going to work well, you know.
The PIVA device, as soon as I heard about it, I thought, that's awesome. All you have to do is take the PIVA device and connect it, insert the plungers, connect the tube, and works beautifully.
You're pretty much just putting a smaller tube into the large tube that's already there and drawing the blood through that.
I have a lot of experience with other physicians, and when I explain to them what this device does, they sort of look at me with this sort of grin and say, why didn't I think of that?
It really is so simple to use. Like I don't even know how to convey how easy it is. I mean, it's like anything. It took about 4 or 5 times using it to really get to perfect it. But once you know how to use it.
Changing practice is always difficult. That's with anything.
The standard way that's done, every time you go into a blood draw, you're worried about getting stuck with a needle.
I actually had a needle stick injury right when I first started nursing, and I know I would get, a little bit of anxiety ever since.
You decrease that potential by using a device that has no actual needles to it.
But just to physically hold it and see how the mechanics of it were going to work, it was elegant in its simplicity, and it was that aha moment and say, this is it. It really will be revolutionary.
Initially, I was a skeptic. I'll tell you, we've always learned that you do not draw blood from that IV.
In here, a lot of times we do have central lines. We do have PICC lines, which is a peripherally inserted central catheter. We have peripheral IVs. We sometimes have arterial lines, which we can draw blood from.
You know what? I would probably say that central lines in general have a tendency to have a higher infection rate than a peripheral line would.
The peripheral IVs we haven't been able to draw blood from until now.
I've had, for the 13 years that I've been here, patients all the time say, well, I have this line in my arm. Why can't you use that? I don't understand.
I think the major thing here, and probably the major selling point even to me, is the patient satisfaction aspect of it.
I've had nothing but good things from patients.
They love it. They're watching it. They're looking at the whole thing. They absolutely love it. They're like, whoever came up with this is a genius.
They're not afraid of us anymore when we say we're coming in to draw blood.
The patient doesn't even know you're drawing the blood. They see it and that's it. It's amazing. It really is.
Yeah, I believe in technology. I believe in advancement, and if it's going to make it better and easier and help the patient and the person that's doing the work, the nurse or the doctor or something like that, I think it's great, and it makes the process even better, and it's probably maybe more precise, so that's how I look at it.
Shouldn't feel one thing.
You don't feel anything.
Okay. And then we draw his blood count. All set. Nice and easy. Take that right out. No needles, nothing in your way. And then all you need after that point is a little flush. It's quick and easy, and you flush it just so it's ready to go for the next draw. And that's it. And just like that, we have your blood.
There you go. Thank you.
Okay.
Painless.
She says, see, I have 2 vials. I said, oh my God. I said, you mean I'm not going to have any more little pinches? And she said, no, not right now.
This is really looking at things from the patient's personal human experience and saying, what can we do to make this better?
I think the part that's so disruptive about this is saying we're taking something that's been so baked in, so taken for granted for so long, and really challenging that at a higher level. It's not a device to me. It's changing the process of care. So the device is just the mechanism to make it happen. But what they're really doing is radically changing how we deliver healthcare.
In the emergency room, ICU, they were wonderful. I have no complaints. The food was good. Everything there was good. But the best part of it was that I didn't have to have those little pinches for the rest of the time that I was there.
The thing that more than anything tells me about the potential of this device is to see the reaction of the patient who started with this device in the ICU and then is discharged to a medical surgical floor.
So when we transferred the patient to telemetry, they needed to draw her blood. Later that evening, she refused. She told them, no, go get the ICU nurses, they'll come draw my blood from this, and she pointed right to the device because she said, you're not gonna stick me.
I think patients are going to be asking for it by name.
And I truly believe for the potential of the company, once patients become aware that this alternative is available, you will not be able to keep it away from them.
For me, the actual delivery of this tool or device is the term I use, which isn't very fancy, is a no-brainer. I mean, how could you not want this as a replacement to the current process when it makes a better experience for the person laying in the bed who's already suffering? As a healthcare executive, I'd sit there and go, how can you consciously not use this? It's less about should people use this, will people use this. It's if we really know that it creates that level of change for a patient, that level of change for a staff member, how could we ever afford not to do this in good faith moving forward?
I hope everybody uses it because it's something that, to me, it's like when they first discovered penicillin. Do we really want to use it? How is it going to work and all those things? Well, they had to try it first. They had to experiment with it first to see if it worked. And it did, and it's developed into many, many things. And it's the same way with this. I was just thrilled. I really was thrilled.